Hello everyone, this is Dr. Sarita, founder of Extra Healthy Life. So today is our podcast about ADHD with our well-known pediatrician, Dr. Rajini. So welcome, Dr. Rajini. So lot of us, especially in Indian community, we don't know what ADHD is. So can you let us know what is ADHD and how is it diagnosed?
Hey, thank you, Dr. Sarita, for inviting me onto this podcast. So, ADHD is an attention deficit hyperactivity disorder. It's characterized by impulsivity, hyperactivity, and inattention, and it is diagnosed based on the clinical criteria from DSM-5. So it's based on the criteria are based on the observations made by parents at home and teachers at school.
That was really good information, Dr. Rajni. Thank you for that. And a lot of times, even parents don't know how to kind of think about ADHD. What are some signs, some symptoms parents should be looking out in their kids to find out if they have a kid with ADHD?
That's a really important question, Dr. Sarita. So, while all the kids can be inattentive and energetic at times, the symptoms of ADHD are more intense and they are persistent, and most importantly, they will be affecting the daily life. So, the common symptoms include forgetfulness, impulsivity, and like lots of fidgeting. And they have struggled to follow instructions and they struggle with the organizational skills. And these symptoms should be present in multiple settings, like at home, at school, and also at social places.
That's a good information. Thank you. And can you throw some light on what are the treatment options for ADHD, both behavioral wise and medication wise?
So, when we are treating kids with ADHD, our approach should be global, including counseling sessions for parents, therapy for the kids, and some school accommodations. And finally, if there is indication, we need to start the kids on medication. So, starting the kids on medication for ADHD is a big decision. So, we need to go through thoroughly if there are real indications for starting the medication. So the one absolute indication would be if the grades are falling in the school and the symptoms are so intense that they are affecting the daily life. So the medications we have are of two types, stimulants and non-stimulants. While the medications help with improving the focus and attention, the counseling and the therapy would be helping with a long-term prognosis in these kids.
And and coming to medication, there is a lot of hesitancy, when it comes to especially Indian parents. Can you talk about that? Since I've done med peds, I've treated patients with ADHD, and then I've put patients on medications, and then they do really well, but it really hurts me that Indian parents are so reluctant about medications, and I see their grades falling. Can you throw some light on that?
That's a really good question, Dr. Sarita. And I can assure that ADHD kids do thrive well if they get the needed help. So, one thing I wanted to stress on is that when there is a real indication for medication, do not hesitate to start the medication, because I've seen there is some stigma, especially in the Indian families, to start the medication for a ADHD kid. In my experience, I've seen parents and families saying, oh, my kid is a totally different one after starting medication. He does so much well in school, so much well at home, and the teachers also notice the difference. So again, do not hesitate to give the medicine when there is a real indication. So as we have discussed earlier, with the school accommodations, some help from the parents at home by fostering their strengths and helping with their challenges, the ADHD kids thrive well. There is no doubt in it.
And also, I think, we always talk about it. We think the families of ADHD children also need some education. We call them as parenting strategies, um, like, putting a timer, setting a timeline, setting limits on their behaviors. Can you throw some light so that our kind of members can get help about how to deal with these kids?
So, whatever technique or the strategy the parents are using, it's really important that they follow the structure and consistency of that particular strategy. So, when parents are giving instructions to their kids, it needs to be really clear, and it has to be made very clear to the kids what's expected out of them. And also, when giving a task, break them down into smaller steps so that they can follow easily. So focus on positive reinforcement, avoid the punishment-based discipline, and just not focus on the result all the time, but do recognize the effort of the kids and praise it so that it keeps them going. Take some time to teach your kids some self-regulatory techniques.
And one other thing, which most of our schools lack is the support. What message would you give for our schools? What kind of learning system would help in schools to support these children and the parents of such children?
So there are many services a school can offer for ADHD kids. So parents need to explore into them, and some of them are like 504 plans, IEPs, individualized education plans. They make certain accommodations for ADHD kids like extended test time and some alternative easy teaching techniques and learning techniques, and also providing them with the movement breaks, which are very much needed for the hyperactive kids in the classroom. So parents explore into all these, and also don't forget to make frequent check-ins with the teachers to see how your kid is progressing.
And when the kids have hyperactivity and impulsivity, those moments, it gets like specifically when they get to that moment, it gets very hard for parents to manage. What suggestion would you give for parents to manage those moments?
So the hyperactivity part can be managed by regulating the energy levels in the kids. This can be achieved by enrolling them into some sports and also scheduling structured play dates. But managing impulsivity is a little tricky. Parents need to sit with their kids, teach them certain techniques like stop and think before doing anything, teach them mindfulness, teach them some breathing exercises, and also tell them certain stories by incorporating the ADHD characters into the story, and tell them that they are able to get through the daily life in spite of the ADHD symptoms.
And what kind of awareness would you think our society needs when a kid with ADHD is with them?
So, Dr. Sarita, I feel when compared to the past times, the awareness of developmental disorders and ADHD have increased among the families in the society, even in India. So, when a kid is not doing well at school, if he is failing grades, or if he's all over the place at home, struggling with the organizational skills, in spite of parents' repeated clear instructions, then do not continue to do that. Rather, go to a developmental pediatrician to see if he's fitting into any of the disorders. So they do have certain standardized rating scales like Vanderbilt and Connors to see if they are fitting into the hyperactive type of ADHD or inattentive type of ADHD. Based on that, we pediatricians or developmental doctors can know what to do with that kid. Either like go with the therapy or the symptomatic treatment, or like the medications.
Also, Dr. Rajni, you and I always talk about nutrition and ADHD since I've done pediatrics also, and I'm a certified nutritionist. So, and I have a lot of interest in nutrition. We always talk that nutrition plays such an important role, especially in ADHD children. A lot of moms, parents ask about what kind of nutrition helps ADHD. In short, in general, healthy nutrition is good for ADHD kids. High protein, especially lean protein like chicken, fish, eggs, beans, lentils, all these are good. And avoiding artificial sweeteners, colored food, and junk food like stored food. I would say chocolate chips and sugary content will help them a lot. When they have all these, for some reason, their hyperactivity level goes up, especially in ADHD kids. Also, they need to focus on eating, more, nuts, cashews, almonds, peanuts. That's healthy fats. Those are going to help them. Pumpkin seeds help a lot because it has like more zinc in it. Also, some other foods which help are green vegetables like spinach helps a lot. Vegetables, they need to eat a lot of vegetables. Lentils, beans are really good, especially in Indian diet. We eat a lot of dal. Mixing a lot of vegetables with dal is going to be very helpful. And avoid prolonged kind of skipping meals. I would say prolonged starvation or skipping meals, because when the blood sugar drops, the irritability in these kids goes very high, and we should avoid that. So make sure that they have breakfast, lunch, and dinner, and then healthy snacks in between. That's going to be very helpful. And don't let them just like kind of order food. I've seen like some kids ordering food online, without telling the parents. Now that this online Zomato, Swiggy, all these, just have your parental controls, right? Even if they order, make sure that like that, and then you ordered something healthy. So that's what I would say, because it affects a lot. Um, in the long term health. So that's what I would say about health. And the next question I had is for you, Dr. Rajni, is about sleep. What do you think about sleep and ADHD, which was an important topic to discuss?
So, ADHD and sleep is a big topic in itself. First of all, when we are managing the symptoms during the daytime thoroughly, that would automatically improve the sleep in the night time. Also, comfortable sleep environment, sleep hygiene, a good sleep routine, all these would help with the insomnia in ADHD. Avoid the screens at least 2 hours prior to the bedtime. That would also help, and sometimes we may use some sleep aids and melatonin, but before doing that, before starting, do talk to your pediatrician regarding that. So, and one other important thing is, if your kid is on short acting stimulant, the timing of the short acting stimulant may also affect the sleep. So, if your I mean, if your kid is on a short-acting stimulant and if it's affecting the sleep, go do talk to your pediatrician.
That's so important. Sleep is so much necessary. Resting improves the brain function so much. So that was really good. And one last question a lot of parents have is what is the long term outcome of the kids with ADHD with the treatment and without treatment so that our members would know in your experience?
That's a really good question, Dr. Sarita. And I can assure that ADHD kids do thrive well if they get the needed help. So, one thing I wanted to on is that when there is a real indication for medication, do not hesitate to start the medication, because I've seen there is some stigma, especially in the Indian families, to start the medication for a ADHD kid. In my experience, I've seen parents and families saying, "Oh, my kid is a totally different one after starting medication. He does so much well in school, so much well at home, and the teachers also notice the difference." So, some help from the parents at home by fostering their strengths and helping with their challenges, the ADHD kids thrive well. There is no doubt in it.
Thank you so much, Dr. Rajini, for coming on our show, and that was very, very useful. So, if you have any questions about the show, leave in the comment box. And as doctor friends, we are always there to help. Dr. Rajini is always available. We can give her contact number, and she can always kind of talk to you online. Actually, whenever I have questions about my children, she's the go-to person. And online, I always talk to her. And when I go to India, I always take my kids to her. She's an amazing physician. So, yeah, she'll be a good source for all of you. So Dr. Rajini owns Ved Children Hospital. It's a very good clinic. If you have any questions and if you are looking for a doctor in India, she can take care of your children. And I'll mention all her details in the description. So yeah, thank you so much for watching, and subscribe to our channel and say yes to healthy life.